when Casey hops in, we can go from there. Okay. Um, well, since we can't approve minutes at this time, so we can kind of move forward and just do introductions then.
Sure.
Do you have a check-in, Ellen?
Uh, yes.
Yes.
We were just we can go around and because we have several guests today,
Yeah.
and you can just identify yourself as a guest or a member or your role. And I think just having any kind of a positive um, statement, hope for the end of the year. It's good to hear. And we can start with that.
Cool. Well, I'll go first then. Malik, he, him, vice chair of the commission. Um, I am really excited. This week is our annual holiday store, where the youth get to come in and get like brand new clothes and shoes and like fun goodies and tech stuff, which is really cool because a lot of our, youth don't get to have traditional like holidays with the family and get gifts. And so it's really, really exciting to get to see so many young people like leave with smiles on their faces and have new things and, feel confident, going back to school with all their peers with like fresh kicks and stuff. So that's really exciting. I will pass to Kim.
Thank you. As I was thinking really hard, what am I going to say? Don't call on me. And then you got the vibe and you called on me. Kim Keller, I use she, her pronouns. I am the child permanency manager for child welfare. Um, and like I said, I'm trying to think of something. I, I'm sorry, I'm stumped. Um, I think that I oversee the youth transitions and then the adoption, guardianship, post-adoption, post-guardianship programs. And I might have mentioned something about this the last meeting, but I have an employee under me who's really her sole focus is to work on expanding supports and services for families within the state that are what we call post-permanency, finalized adoption or guardianships, with the idea that they don't have to, come back to child welfare when they need help. And she's done a tremendous job in the short time that she's been in the role of expanding some contracts and creating some new contracts. And the momentum is going, and she's got more that is in store for 2026. And Rachel, just so you know, talking about new things, I'm sure in the current budgetary structure might be a little like, ooh, what's going on? But we can do this through a funding stream called Adoption Savings, which is not State of Oregon General Fund. It's money that we essentially have based on the expansion of those children who are FOIA eligible. So no impact to general fund budget at all. And it's been really fun and exciting to be a part of the work that she's doing and, expanding what is out there in our communities. So more on that. And Donna, I'm going to pass it to you.
Hi, everyone. I'm Donna Haney, she, her pronouns. I'm the assistant manager on the child welfare foster care program. I'm not sure anything could be cooler than what Malik just said. When you stated that, I was like, that is so exciting, Malik. And it makes me want to cry. Like, that's amazing. Um, I guess I will just say I this morning I pulled up a invoice actually, but with invoice is a report, and I just reading over the last year what an organization we work with has done to connect siblings who are separated in foster care. I mean, it was just really uplifting to frankly read in them on a Monday morning. So it's Kindred Matters is the organization, and they really have done some great work connecting siblings separated. So that's my positive for the day. And I'll go to Dan.
Yes. Hi. So I'm Dean Salazar. I'm a former foster youth myself with autism and stuff like that. And I've served on several stuff, the Portland Children's Levy, Oregon Commission on Autism. Now, starting next year in August, the Autism Society of Oregon and stuff like that. And one thing that I'm grateful for is the ability to just speak to, these people who work with child welfare and stuff like that, because this has been something that affected my life for many years, and I'm excited to be able to collaborate so that we can improve things. And I'm hopeful that this is the beginning of like a long-term collaboration, since we really need to do a lot of things for people's, full spectrum health, mental, social, emotional, and of course, upwards mobility. So those have been the 2 points I've hammered on since I've gotten involved, and I will continue to do that because those are the two most important things of our time, in my opinion. And this is a large part of it, in my view. So, yeah, thank you. And I'll call on Monica.
All right, thanks, Dan. I was going to say what you just said. The opportunity to collaborate. We all know that solutions come about through partnerships. Um, a problem shared is a problem halved. The more we can do together, the better things turn out. So I was going to also mention all the opportunities that have been coming about for collaboration. So I'm Monica Giluli, and today I'm representing CWAC, and in a few minutes I'll tell you more. Thanks. I'm picking Alex Island.
Hi, good morning. I'm Alex Island. I use she, her pronouns. I'm a member of this committee. I have been trying to think this whole time of what to say. I'm very grateful to be here today, and a member of this committee. And something positive. I've just had this past couple weeks a lot of events with friends and community that are like honoring people's cultures and their family traditions. And like we just had a thing on Saturday where we made everyone made a dish made by his grandmother that he went to as a kid. And just those acts of getting together and showing up in different ways and what community looks like. And how that impacted my work when I did work in child welfare. So just grateful for the ways communities show up for each other. And then I will pick, who's next? Rachel.
Hi, everyone. It's nice to see you all. Rachel Kearns Henry, she, her, hers. I work with Governor Kotek as Senior Human Services Advisor. Some positives and just kind of things I feel good about related to community and related to engagement. I was really happy. I had a chance to go to the Oregon Business Summit last Monday. And when you think of Business Summit, you don't think of seeing connections with child welfare, right? And I was just really excited because they, of course, Bridge Meadows and that organization was there as part of this session where they were really talking with the business about their intergenerational work and their living and how do we build the type of housing that really supports one another and supports community. And I love when I get to see something like a great model like Bridge Meadows being presented in a non-traditional place, right? Where you might not have expected to see that presentation. And having such a captive audience and a really large group there was really great to see. And that just brought me joy. So I'll share that. Oh, and I need to call on someone. I see, I don't think Casey's had a chance to go. Casey, I'll turn it to you.
Good morning, everybody. They might be calling my case in just a second, so I might have to jump really quickly. No, not my case. I did not hear the beginning. If it's something about positivity, right? Could anybody jump in and tell me what the prompt was?
Yeah, it's just something that you're positive for about in the future, what's going on, just something to brighten everybody's day, I guess. Yeah.
Yeah, I mean, for me, I take solace in individual victories, small victories, and bigger picture. I don't know if there's anything super exciting for me right now, but it's the time of year where everybody, even if they haven't been active in a case, is coming out and they want visitations, they want to see their kids, they want family time, and I like to see every single case whenever you have that small victory and you can get a family together for a Thanksgiving dinner or a Christmas trip. That excites me, especially the way the parent reacts when they get that trip. Just that excitement keeps me going, drives me to do this work. Let me look at the participants. Ellen, have you gone?
Nope, I have not. So
Okay.
thank you, Casey. Ellen Bell, she, her pronouns. And something, this seems odd, but this morning I read this really cool report, the Charting the Course. It's a blueprint for child welfare financing and accountability reform. And actually, I found it kind of uplifting and hopeful. And I was really excited by that. And that's nice that we can, sometimes the things we read are, make us concerned or, I don't know. But this was actually pretty well done. And so that was kind of my positive thought for the day, starting and reading the report first thing and feeling like it had a lot of good content. And I will pass it over to Alexis.
Thank you, Ellen. Good morning, everyone. My name is Alexis Amarelli. I use she, her pronouns. I am currently serving Oregon as the foster care ombudsman with the Governor's Advocacy Office. I'm very grateful to be here. I am in this space as a guest, so very thankful to be a part of the conversation. Something that I'm super excited about that I have been hearing since I first started in this position almost 2 years ago is how the public has really, and I think this commission also has really wanted to see recommendations out of our office be public. And I'm really excited to report that that information is going to be public. We are now putting it into our reports to post publicly. And that is a result of this commission and public experience and people wanting to participate in that recommendation process. So super excited to report that back to this commission, especially. Who has not gone? Bryce? I don't think you've gone yet.
Hey, good morning. No, I have not. Yeah, my name is Bryce Funk. Happy to be here. I've had this meeting on my calendar several other times. I just haven't had the availability. But I'm here as a guest. I work. My wife and I are resource parents, and we've been doing that for the last like 4-ish years. And we have one child through guardianship that we fostered. I also work a bunch in service agencies. I do media and marketing, and so I work with Salem Angels. So as far as positive outcomes, right next to me in the office next to me, there's a bunch of our case managers that are packing Christmas gifts and stockings to deliver to resource families and youth experiencing foster care. So super exciting. And I'm looking through the list here. I think Jesse, have you gone yet?
Nope.
Is there
Thank
Jesse?
you. Thank you, Bryce. I'm Jesse Powell, Commissioner. He, him pronouns. I think one of the most inspirational things and privileged things I was able to do this year was this weekend. We did We See You event here in Salem, meeting the houseless where they're at on the streets and feeding them. hot chocolate, socks, feet massages, hygiene kits, resource tables around the event. It was 3 hours or 4 hours of just being privileged to be able to show up and support my community and uh, elevating the individuals that are out there displaced. So, and I will go with Alicia.
Good morning, almost afternoon. I'm sorry I was late. I was in a team meeting, went over. My name's Alicia Richard. I'm one of the commissioners, and I take notes. So if you see me looking weird, it's because I'm typing. So we're doing something that was inspirational this year. Is that right? Okay. I mean, this past weekend I was out delivering gifts to treatment centers, kids in treatment, parents in treatment, and some of the parents are involved with child welfare. And just that in itself is like a gift. I get to go and share a little bit of my story to connect with some of the moms, and they're just so, so, so grateful for anything. And yeah, it was just really fulfilling and awesome. Let's see who hasn't gone. Kim, have you gone? I know it was late, but I didn't hear you.
Judge Jaco hasn't gone.
Okay.
Yeah.
Judge Jaco, whoever.
All right, I'll go. I'm Megan Jaco. I am. I've been really impressed this last month with the depth of appellate advocacy we have about dependency cases. There's been a lot of interest on my court and on the Supreme Court with handling these cases better and really talking about the issues. And I think that interest can only help us in the way that we can help our families and do the cases better if the higher courts are paying attention to them. So those things are encouraging to me. And I went out shopping yesterday. I haven't spent too much time in the community lately, but it was really good to see everybody in the Christmas spirit. And I thought that I've been impressed hearing all of your stories and how it seems like, despite the fact that we're heading into a bad budget climate, that people are being generous in their hearts, and so hopefully we'll be able to weather some of this. Am I last in, or did Kim not go?
I think it's Ellen is left. I think it's Ellen.
Ellen went.
I already went.
You did? Oh, you did. Okay.
Yeah. Okay.
That I think that is everybody, and we do now have quorum, right? I'm counting.
Yes.
Yes. So then do we want to move to approve the minutes for November before we forget?
I'll move.
Do I have a second?
Second.
Minutes approved. Look at that. Okay. Yes, Ellen, I know you wanted to share about the
Oh,
workday requirements.
just a reminder, yeah, that you probably all have gotten notices from Workday about the trainings required for the end of the year. And if you have any questions about it, please let me know. There are folks from the board administrators group that are doing some collaborative trainings for people that don't want to do them on their own, but want to do them as a group. And so I think I sent out an email about that. If you're interested in it, or if we want that for the commission, that's a possibility. But just if you have any questions or any trouble with Workday, because I know sometimes we can't get on, and or a password all of a sudden doesn't work. So just let me know. We'll get that taken care of, and get those taken care of by the end of the year if you can, if you have a moment. So that's
Is that
Mhm.
we need to have them done by the 31st?
Right. Yes. Yeah. Any other questions on that? I'm sure everybody's seen those notices.
I got a question. If I go into Workday and would it be something that I need to do? Will it say that I need to do it?
Yeah.
Okay, thank you.
It should be there saying that you definitely, you might have gotten an email about it, but I'm not sure if you did.
Yeah, I think I did mine coming into this because I came in at May. So I think
so
mine are
too.
already done, but I'll check. I'll double check.
Yes, I think you may have done yours, Jesse, but if anybody has any questions, don't hesitate to reach out, and I'll probably be looking here in the not so distant future. And so that's the main thing. And then I just wanted to turn it over to Monica Galuli for a few minutes because she is one of the vice chairs or one of the co-chairs, sorry, of CWAC. And there's been a lot of talk about CWAC wanting to do some collaboration with the commission. And so she'd like to speak on that for a few minutes.
Thanks, Ellen. I'm going to be different. I'm going to talk about the why I'm here, and then I'll talk about who or what CWAC is. So that way you'll have the thought in your mind when I tell you about CWAC, if you don't already know about us. Challenges and issues aren't just a child welfare issue. CWAC is Child Welfare Advisory Committee. The populations that we all work with overlap in so many different ways. So child welfare also interacts with behavioral health, OHA, education, and there's different facets. But in the name of collaboration, we have decided to start inviting other groups that might serve intersecting populations, but in their own unique ways, because none of us are doing the same thing. But we'd like to invite a member from each group to show up at a meeting, show up at our next meeting. We'd like to know who you are and what you do, what you're responsible with or for, and we're going to share the same information back. We want to know who you are, who everybody is, and then we want you guys to know who we are. So when challenges, and somebody just said, I think it was maybe Jesse, but someone just, I'm sorry, Judge, Jack, you just mentioned the budget cuts coming up. With budget cuts, the more collaborating between stuff, maybe that'll help some of the ways. But again, so we want to work with other groups. We want to at least start off by getting to know who you are. And then my idea is supporting each other, brainstorming ideas with each other, leveraging support if somebody is going to be putting forth a proposal. If there are thorny issues that they would like another group to come in and have our support behind you, or even just to hear it out and say, ooh, that's, something else. So that's kind of the why. Really, basically, we want to collaborate. We don't want to duplicate. We want to use our strengths to get better. And so who we are, CWAC is legally mandated. We are also the oldest advisory committee in Oregon. We've been around for 40 years. We are 21 members who are all selected to represent specific groups, shareholders, or even areas. We serve a 2-year position we can be asked to continue. But our role per our policies is to counsel child welfare in the development and administration of policies, procedures, and practices. So basically, without CWAC, child welfare does not get recommendations from an advisory committee. We are mandated to be their advisory committee. We also just learned that we have our own authority to make legislative recommendations in our annual report, of course, taking into consideration budgeting. But so our ask for today is that we would love one of your members, one of your commissioners, to attend our next meeting. And it's going to be, we are always every other month on the 4th Wednesday. So it's the 28th. We meet from 1 to 4. However, we've slotted collaboration time for around 1:30. So we're not asking you to stay. We're not asking you, you're welcome to stay for our entire meeting to find out what goes on. We also get an update from the Executive Leadership Committee, which is lovely. And I see wonderful representation today from both Lacey and Orlando. So I'm thrilled to see everybody. But again, my ask is that by the end of your meeting today, maybe somebody would be available to come and share who you are, what you do, and even if you've come up with ideas of if this is something you'd like to do to collaborate, we will be inviting a different organization to each meeting, maybe 2. But we want to build a better network. We all have great skills, but sometimes we overlook or we don't know about somebody else's unless we're working together. So that's kind of I I'm here as the CWAC co-facilitator, one of the 21 voting members. My background is I am been a CASA for 15 years, and I've been a CRB member, Citizen Review Board meeting for kids in foster care under the Department of Justice in Oregon for 7 or 8 years. I live down in the southernmost point of the state, very rural. And I represent people who are Hispanic, people who are military, people who are homesteading, and again, without a lot of resources. But today I'm here with Child Welfare Advisory Committee. I'm welcome to answer things in the chat. I know y'all have a busy meeting, but if anyone has a quick question, I know that you don't have a lot of time, but does anyone want to know anything? Hello, Alexis.
Yeah, I was curious about what, like, sorry, just
Hi,
curious
Dan.
about who makes up your committee in terms of like the backgrounds and yeah,
We
just
have,
curious kind of what that looks like.
yeah, it was the facilitators from last year, well, from the last 2 years, got together and they really wanted to represent. We have people representing women in youth, females in child welfare. We have attorneys. We have Morrison, the peer mentor program. We have just people who represent any kind of organization that they could think of, but it's all related to child welfare. So we're trying to cover, we do have one opening, and we'll be looking to fill that with something that we're missing. We get together and say, who don't we hear from? But basically, we want to hear from all the different groups of Oregonians who may be impacted by child welfare. So our list of members, if you want to go into our website, it's under ODHS. You just put ODHS CWAC. You can see who exactly all our members. And if you click, you can see who they are, if you'd like, Dan.
Very similar to ours.
Mhm.
So for the Governor's Child Foster Care Advisory Commission. The other thing I did want to mention is it's been really interesting this year that formerly the chairs of CWAC had been staff of child welfare, and this year it was we have two people that are not child welfare and are just straight up members of CWAC. So it's really exciting to see the growth that's happening there. And I really appreciate you coming today, Monica. And I think
Right.
Ian has a quick question for you before I hand it back over to
Less of a question, more of a comment. I would be very excited to participate in that and to be the volunteer since I work on this. I work on a bunch of other programs for youth and people with autism and stuff like that. I've been meaning to. I've real actually my career and career on boards and commissions and in public in the public sphere has been built on more collaboration, on really breaking down these silos and making as much progress as possible. So this is right up my alley. And as you can see, I'm basically chomping at a bit. So I'd love to be able to do
I did
that.
see your comment, Dan. Why don't you just throw your email into the chat if you don't mind? It will make sure you get an invite.
Excellent. Sounds wonderful. Unless someone has, and unless anyone has any objections to me being the one.
Well, knowing that you are the one, that you're available on January 28th from around 1 o'clock, knowing that you're there, people can always send something. If
Mhm.
somebody thought, oh, we need to cover this, or please talk about this, or they can always reach out to you.
All right, sounds good.
I know that Casey was going to talk about um the bylaws committee, but I'm assuming Casey's still in court. Um, yep, okay. Then do we just want to, could we maybe then, in lieu of Casey, I know Rachel did want to jump in and say some quick little things if you're down to go now.
Sure, I'd be happy to. Nice to see everyone. Um, All right, so maybe just level setting big picture. Where are we at this point of time in the cycle of government administration and budgeting work? I feel like that's always high level where we need to zoom back out. Um, we're in a strange period because normally, as you know, we do biennial budget development, right? So we had just worked with everyone and we were really, I was just here reporting to all of you about I would just say really the great successes we had. Just want to remind us all, right, of making sure that we were navigating and ensuring that we had the investments we needed within the Department of Human Services to maintain strong operations of our child welfare program and operations overall. And we had key investments that we were really proud that we were able to maintain, including some investments that we made over at the Oregon Health Authority to ensure that we were building capacity that we needed overall to ensure that we could have behavioral health capacity that also serves our kids that with complex needs that are part of the child welfare system. That work for implementation, I do want to note, is continuing, right? So we've been meeting with Oregon Health Authority. We've had a joint work group between Oregon Health Authority and the Department of Human Services to ensure that we're really looking at what are the highest priorities where we need to build capacity, and the teams working through proposals for how they began allocating that $10 million to build capacity where we need. So that's great news, right? That's part of where we are in terms of landscape, got through a big budget. Now the teams focus on implementing. Challenge we have, as you probably all know, just reading the news and seeing the environment, is that we're not quite done with budget because we have a deficit still. We had a $372 million deficit just kind of going into this short session. And the legislatures has, of course, said, we need to help make sure we solve for this. And we need to help make sure that we are planning for what's ahead. And we have a whole host of other changes that occur. We would just note changing federal landscape, changing federal laws, then also reduces revenue and investments that are coming into Oregon, which also puts us in a negative position as well, right? So the legislature is setting up for short session, and they're going to have big decisions ahead. And one of those decisions they're really trying to navigate is how are they going to essentially balance and the budget, and what is that going to look like, and how are they going to make sure that we are in a place where we need to in this interim short session as we actually work on larger long-term budget development, which needs to get back to its normal cycle of that 2-year cycle. But as part of the short session, right? So short session, we come in, it is just that, it is short. There's legislative days in January, and then we end up going into session in February. The legislature is going to be making decisions about, are there going to be reductions that they need to approve? And if so, what level of those reductions will they be seeking, and what's their approach to take that? Those last two questions are really important, right? And I can note we don't have answers to those yet, and nobody has answers to those really publicly or navigating, right? How much of a budget deficit are we really navigating? How much are we going to cut? These are a lot of discussions that and the economist and the budget teams are really navigating and looking at to really understand what does that whole portfolio look like. And part of what you're going to see kind of coming forward over the next few months are the key building blocks of those pieces coming together to really make sure that we can come to a conclusion. One of those building blocks that the legislative partners asked is they asked every agency, please give us a list of reductions that you could implement in your budgets. They asked for a 5% list of reductions across each agency. Now, Department of Human Services is a really large agency. And what that means, as like the largest agency in the state, and when you think of a reductions package, that's a lot of money. A 5% reduction actually is $372 million. Just want to confirm. So I want to just note it was a reduction exercise. I want to emphasize that as well. Every agency is putting their reductions together, and the legislature is looking at those and thinking about that in terms of understanding where there are choices and options that they may have as they consider if there are reductions they want to take or other investments that are needed as they work to ultimately balance the budget in short session here. In January, let me just note, the departments presented on those reductions during the November legislative days. So in November, you heard all of the agencies speaking to that. The Ways and Means co-chairs are leading this process, and they have directed the sub-chairs of the Ways and Means to hold meetings with partners between now and the beginning of session to identify any feedback on concerns or areas that they want to ensure, that we want to ensure, like investments are preserved, or if there were reductions that agencies put on that may be problematic, that advocates or partners have said, no, please don't take that reduction. I'm sharing that because that is an opportunity and a process point just for you to be aware of, right? So the sub-chairs of Ways and Means are now listening and taking feedback if there are any of those reductions that would be a bad idea for any reason to consider. And so that's, again, kind of part of where there's an advocacy approach that could be considered. I would just note one, when you look at the DHS budget, taking reductions is really hard, and we would say any reduction that we had at the DHS side is a hard choice. It's going to have a consequence somewhere, period, right? So much of the budget is provider rates, and it's also then just required services. What is an entitlement? What is like something that somebody must have? And there's eligibility criteria and benefits criteria for how you define that. In that spirit, when we also did not have extensive amount of stakeholder engagement time. I want to just note that we were very clear in that as well with our legislative partners. This was not some sort of fully vetted, these are reductions that we all agree with. That is not what this is. These are in fact reductions that we would say our preference would be to make none of these and to continue with the budget that we just got through over the last session. But this is where we are, and you've asked us for this. Here's options that are at your table. The approach that we tried to take was to really look at we do our best to make sure that we're maintaining and preserving essential services. That's what we have to do. Making sure that the essential services Oregonians depend on for DHS, that we could preserve as much as possible. And then maintaining the infrastructure to support those services is part of it. And then we also have to really think about the rest of the landscape. We had to look at the landscape of the fact that we're going into we have a federal environment, and HR 1, the House resolution bill that changes how human services and Medicaid are going to be financed, essentially, also has budget impacts, and it has additional work investments that we need to be making as well in order to do the work that's in HR 1. We also had to think about and monitor, where do we have caseload growth? Where do we have demand for services, and what do we need to maintain? And we had to think about, where do we have litigation? Where do we have the fact that we have principles and agreements that we have, that you all know of, especially through our Wyatt Collaborative, that says, here is by law, what you need to be working on, state, and where we need to then make sure we maintain investments, and we can't back down off of these approaches to get to our overall goals. So we have to take all of that into consideration. And we also had to think about really defining what were the core functions of the Department of Human Services, defining those core functions, and identifying any new programs that had been put in place over the last 6 years. Because reminding the legislator that the legislative teams asked to say, how are you doing at any new programs that you had implemented? And as they consider, is that really the work? that we want to make sure that we can continue to do. So the department, did its best to take as balanced approach as possible. When I say balanced, what I mean is that we had to take those principles, but we did not give a 5% reduction list that was all provider rate decreases, right? And we didn't take, there is a combination. There were staffing reductions from the department that was included, right? It was important to show that are there services and functions that we no longer should do, would do anymore, and here's what staffing reductions would look like. We looked at anywhere we could in terms of where you could reduce operational cost and administrative expenditures with services and supplies. We reduced those. And we looked at certain programs or benefit changes as well. And you started to see some of those peppered in. And what I mean by that is there's certain benefits maybe that we do that are optional or that are above and beyond maybe a base benefit. And how do we start looking at some of those programs? None of these again, are great ideas. I would say that right now, and we don't have a ballpark. We don't actually know right now what approach the legislature will be taking. Are they going to be asking for a certain amount? Every agency gives up a certain amount of money. Are they going to be taking a different approach in terms of overall principles? That will be part of what you're going to be monitoring and we're going to be thinking about and observing as we go into the short session. So that's just kind of what's to come. What can you do now if you're interested? Making sure that if there are any of those investments on our reductions list that you think are really important, that you want to make sure that you're advocating for, you can always let your voice be heard by letting the sub-chairs know that information. That's a process step you could take at this point. And that's not necessary. I'm just going to note as well, like if that's, I know you have to orchestrate a lot to do that. There's a lot of unknowns, right? So there's, but as we know more, we will share that information. When I say what will we know more, the size of the budget box, how they're thinking about taking those, approaching that work. And then there's other questions on the revenue side of the house as well. What's the pool of funding that they'll be using? The other consideration I just want to make sure that you're aware of, just to understand like the broader landscape that we are working in, is within the Department of Human Services, we also had to we will be making, it's being released right now. You're going to hear the presentations in January, but the Department of Human Services and Oregon Health Authority also needed to ask for more money to do what is the base minimum of the federal requirements for the new Medicaid and SNAP provisions. So meaning, while we're in a tight budget environment and we're asking DHS to say, what might you need to reduce to help us manage the budget? At the same time, we are needing to have the agencies ask for more money to do the base requirements to comply with the law so you can maintain a SNAP program. That's all I'm saying. Maintaining food for people in Oregon is going to cost us more money, up towards $100 million in additional general funds that we're going to need to ask. And that's going to need to then come at the potential expense of looking at possible reductions that we have. So this is again kind of the odd budget balancing perspective we're going to be going into for short session. And that's what we're looking at. I can tell you, I think what's really important is to also think about what's not on the list for the 5% reductions. What I can tell all of you when you look at this, there are certain areas that we absolutely preserved that you don't see. There aren't any reductions for rates for foster parents, for example, resource parents. That's not on there. Investments that we had just done with our temporary lodging investments, Those are not on there. We were as strategic as we could about thinking about where we needed to maintain investments, but we had to find savings someplace, and so you are going to see some areas on that list. That's essentially what I have to share in terms of where we are, where you could, if you wanted to advocate or have more information, we could get you more information. But this is kind of the environment and what we'll be navigating over the next 3 months or so here. I see Alex has a question.
Sorry, I was not on mute. Sorry if I missed this. Someone came to my door and I missed a couple minutes of this. But did you touch on ODHS and state agencies' use of contractors and the funds? I know there has been a lot of public commentary and things in the papers. I've worked on those and what that looks like and how those cost reductions could be spread throughout with using state employees who are already present instead of hiring outside.
Alex, are you speaking on this more broadly?
And that would impact ODHS. I know that there's ODHS contracts with like Deloitte and different large contracting organizations.
All right. I hear you. So what I would say is that, overall, when we look at the reductions and we look at, and we look at our investment approach that we're taking for HR1, we are prioritizing and we are doing as much as we can with state employees as we can. I'll just state that. That is our approach, especially as we think of the HR1 implementation for SNAP. We think, especially on our eligibility side, much of those functions need to be done by state workers. And so you are going to see investment requests that will be focusing on increasing state footprint there. And Alex, I wonder if you might be able to go on mute, or is it somebody else?
It's not me. I'm not sure. I was on mute. I was wondering the same thing.
We got Judge is off. Oh no, she's on mute. So.
Got it. So Alex, I would say hopefully that answered your question. We do look at contracts. We look at where we have contracts, where we have state staff, and I think that there's many times a hybrid approach. We try not to over rely on the expensive contracting through those like Deloitte and others, but it's necessary, especially at times for some of the systems work that we do. They have a niche support that no others can do. So we do as best as we can to balance. Dion, and then Casey.
Yes, thank you. So I was listening along while recording some stuff, so I might have not heard a couple pieces. Also, there's the ADHD, which I hate, but but if I'm hearing and remembering correctly, you haven't mentioned like a lot of specific cuts. That's going to be handled in legislation, correct? Like a lot of specific cut programs.
The legislature will make any of those decisions, correct? Yes.
Gotcha. Well, yeah, from what I heard from you, the general topic of your speech was just talking about, if I had to simplify it, of course, is that you guys are aware of all the circumstances and stuff like that, so you guys are trying to be as careful as possible, if I had to sum it up in one sentence.
I would say that there's a great deal of uncertainty, that the need to have levels of reductions this session is a certainty. There will be reductions. How much those reductions will be and how the legislature will choose to seek those reductions through specific agencies is the unknown.
Gotcha. Thank you, Rachel, and I appreciate all the work that you guys do.
Yeah, thank you. Oh, and it looks like Casey, I'm sorry we didn't get to Casey's question before he got called back.
We can move, because I know that did take quite a lot of time, but I know that you and Casey also meet separately anyway, and so I think that's a place where that can be brought in. And And I think if anybody else has any questions, can just email and can go out off, outside of chat. Um, yeah, if we want to move
Absolutely.
to Lacey and roll on. I appreciate thank you so much, Rachel.
Yeah,
Appreciate it. I
thank
know we're
you.
like time for time, but yeah, thank you. Oh.
Is it our time?
Yes. Yep.
Okay. Good afternoon, everyone. Thank you for having us. I was just going to say, your Golden Girls are kind of distracting. I keep looking at them instead of you. Um, I am gonna, let me see, I'm not as familiar with, how do I share my screen? Can I share my screen? Ellen, do you have our PowerPoint?
Green square on the bottom, Rolanda, in the bottom
Yeah,
row.
you can share. You can share.
Uh, oh, got it. Sorry, I'm so used to Teams that okay, we did a little, can you all see it?
Yep.
Okay, I'm trying to get back into okay, here we go. Sorry, I'm not as familiar with this as I am in Teams. Okay, so thank you again for having us. Today we're going to talk a little bit about our new expanded child welfare report to the governor that we just completed. Program improvement initiatives. We were going to talk about the budget, but I feel like Rachel covered a lot. So if you have any specific questions for child welfare, happy to answer those. But for the most part, she spoke generally about everything we were, as an agency, we're doing. So for those of you who have not had a chance to see it, we really spent the last few months working on a much more robust child welfare report to the governor that's now posted on our website. It really goes through the 4 priorities we're focusing on, which is keeping kids safe, supporting families, improving services and outcomes for children in foster care and their families, ensuring a well-supported workforce, and enhancing our infrastructure, and then utilizing data for accountability and continuous quality improvement. The link is in the PowerPoint, so if you want to, I'll have Ellen kind of copy and paste it into your chat. It's on the website, so please feel free to go look at it. It was quite a few months of work, and it really highlights quite a bit of the areas we're working on. I think I mentioned in my first meeting that we're trying to really hone in on our core work and really reducing a lot of the pilots that we're doing or special projects, and really focusing on ensuring that our teams are really focusing on the 3 major initiatives, which is the collaborative agreement, our PIP, which we're still waiting for our final report from the feds, and then our safety action plan, which we have drafted with some clear strategies and outcomes that we'll be tracking regularly. So really, I mentioned the 3 areas that we're working on, and in this slide, it just talks a little bit about how they intersect. I think what we're trying to do also is, I think I know, because that's what we're doing, is take all 3 of these areas and making sure whatever work happens in one is really crossing over to the other initiatives so that people aren't working in silos. I think, in the past, we would have one area we want to work on, and so folks would really focus on that and not making sure it crosses over. So our attempt is really to try to say, if we're going to do something around the PIP or the Child and Family Services review, our corrective action plan should link to the other 2 and have some impacts across the board in child welfare. Our collaborative agreement, the same thing. In this one, it just talks about, our the CFSR round 4 is a 2-year plus 1 year to reach improvement goals. It shows that it's a short-term application. Collaborative agreement, as some of you know, because Lacey, I'm sure, has done many reports on that. is really much longer. It's a 10-year commitment with clear intervals of reporting to the courts. And we're also paying a neutral who's keeping us on really trying to make sure that we're following what we committed to do. And then our safety action plan is actually much shorter. It's focusing on really improved work across our delivery system in a much short and succinct way. I'll turn it over to Lacey. She's going to talk about the 3 areas and how they cross over and the outcomes that we're looking for. So she can walk you through that.
Thanks, Rolanda. Good afternoon, you all. Lacey Andreessen, I use she, her pronouns. I'm one of the deputy directors for child welfare. The Child and Family Services case review is a requirement of the Administration for Children and Families. It has to be done on a regular cycle, and then the federal government reviews it, approves it, and creates the program improvement plan. That's areas that we want to improve on. These are the 3 areas that the CFSR covers. Here in Oregon, we do the CFSR on a regular basis all the time as our work towards continuous quality improvement. That's not required, but that's how we look at areas of practice across the state where we're doing well and where we need to improve. The areas that are covered under the CFSR are safety outcomes, permanency outcomes, and well-being outcomes. You can see them listed there. You can go to the next slide, Rolanda. We have talked about this one quite a bit. The collaborative agreement that came about as a result of settling the Wyatt v. Kotek lawsuit last year. It seems like it was 5 years ago, and it was just last year. To be in compliance with this, there's 26 strategies or focus areas across the state. They too are across safety, permanency, and well-being. So you heard Rolanda say we are implementing or improving practice areas that will move the dial on all of these 3 efforts rather than having 3 plans for 3 different things. And then this gives you some deep detail about the safety action plan, ensuring high quality screening practice, ensuring timely CPS assessments, improve the quality of safety decision-making, and act on safe systems analysis. So each of these have efforts you can see underneath them on the specific tasks that we're doing, work that we're doing, and then behind all of those, there's also the actual tasks. And all of these we are measuring and tracking to be sure that the things we're doing are impacting our practice the way that we think it will. And then you heard the update from Rachel about the budget. I think Rolanda and I would be happy to give you more specifics about child welfare if you have any questions. And then that was the last slide, Rolanda.
I know in this slide we talk about key strategies. One of the things we have implemented is a 90-day hold on vacancies. We have some exceptions in those positions. Our CPS positions have been given an exception to that hiring hold. It's just a delay in hiring. And so that was one that we just implemented already on November 15th. Everything else is still waiting for what Rachel described earlier.
And the last thing I'll just add, and then we can see if you all have questions, we can really see some significant progress in a couple of key areas based on the work that's happening. About 4 years ago, our timely case plan, so that's when a child enters foster care, we're required for their parent to get a completed case plan that shows both the well-being of the child and also kind of the roadmap for a parent to move out of child welfare, get their children back, and then have their case closed. We got those done on time within 60 days, about 16% of the time. And last month we were at 89.8%. And so we've dramatically improved. We also, via some of this work, have the lowest number of overdue assessments that I think we've had in this agency since I've worked here. We have large districts who are keeping them at 20% or under, and some even lower than that. We do still have a couple of districts we really need to hone in on because they have not made the progress that the rest of the state has made, but we're down as a state at around 40% overdue. And a year ago at this time, I think we were at 56%. So those are really important pieces of work that we're just really excited to see moving in the right direction. A couple things coming. There is a short session this year. Oh, go ahead.
Yeah, sorry, I'm writing some stuff down. So,
Okay.
so you said what was that 40%? I just was writing other stuff
Yeah,
down, so I
that's
didn't.
fair. We talk a lot. That's the number of open child welfare cases that have an overdue child safety assessment. So we're supposed to have assessments completed with the disposition within 60 days. And right
Mhm.
now, 60% of ours are done timely and 40% are not. But that is not an acceptable level yet, but it is trending very specifically in the right direction.
Gotcha. Because of 2 years ago, it's at 16%, right?
That was case plans. Yeah, 2 years ago, it was 16% of case plans were done timely, and now we're almost to 90%.
Gotcha. Thank you.
Yeah, that's good. We want the case plan timeliness to go up and the number of overdues to go down. So we're headed in the right direction on both tracks. It is supposed to just be a short session this upcoming session. There seems to be a lot of murmuring in the air that we may actually see some child welfare policy change proposed. That doesn't usually happen in short session. And I balance that by saying, you heard Rachel talk about all of the work the legislature is going to have to do around the budget. So there may be some actual statute change, which we don't often see, but we're going to be watching for that. And then we also know that the co-chair of the Senate Human Services Committee, Senator Delcer Bluen, has said on the record that she wants to start a legislative work group around temporary lodging. And, I think we've gotten into a lot of micro conversations about really specific parts of that work, but what she is proposing is coming back really to a macro level, looking at Oregon versus other states. Why are there still children in temporary lodging here? What can be done about it? And look at it from a community and system perspective versus putting child welfare sort of under the microscope about it. So we're excited about that work as well.
I think the only thing I was going to add to what Lacey said, if no one has any questions, is really one of our real key strategies is to make sure that we're also working on the delivery side and making sure we're holding ourselves and our delivery staff accountable to some of our strategies. I think historically we've had we've recommended, suggested things for districts, but haven't moved in a systemic way around really making a shift and making changes. And we're changing that a little bit to say, if we're going to go this direction, we all are going to move together and we're all going to do it in the same way so that we can really see the difference and the impact. And that's why I think we're seeing some of the overdue work really make an impact. So I really appreciate our delivery partners and district managers coming along and helping us achieve some of these. Because I always say, program, a policy can do all this work, but if on the delivery, they don't actually implement or do the things we need them to do, the dial doesn't move, right? So I can appreciate them. Any questions, Lacey and I?
Yeah, my last question is actually one that I put in the chat since I was writing. I sent it to you personally. But just again, so I can write it down. The first two stuff for the focus safety plan, the shorter focus on improved delivery. This is near the earlier part, or did you not mention the other two things? So, I know I suddenly started to take notes and everything.
I'm sorry, maybe I missed it. What's your question?
Yeah. So you were talking about the three service areas, and one of them you talked about was a focus safety plan, like shorter focus, is focusing on shorter focus service delivery.
No, I think what we were saying is the safety plan has a shorter, much more like a quicker move. I think that's what you're referencing. The collaborative agreement has a much longer, it's a 10-year plan. So it's going to be a lot of work that happens over an extended period of time. And then our PIP, which is sort of in between, that we have to report up to the federal government. So these are the three areas that we're working on. But hopefully whatever we do in one is really going to impact the other two because it has ramifications for all of the expectations that we have in all three programs. I hope that makes sense. We're happy to send the PowerPoint to Ellen too, so she can forward it to all of you.
Yeah, I would appreciate that. Thank you.
Sure, of course. Anything else? Well, it was a lot quicker than they gave us. I'm glad Rachel came and spoke as well. So thank you.
Thanks, you all. Good to see you.
Donna, I think if you want to go next, we've got about,
Sure, I can be really quick. Ellen, I don't know if you've put the documents in the chat yet that I sent earlier. This agenda item came from last month. Right at the end, there were some questions about certification. And so Ellen put this on to sort of in general make sure we get all the questions, and then I can answer some, but we can also get some folks to come. If I got the specific questions or concerns, we can have folks come in upcoming meetings. The one piece or a couple pieces. One, I know maltreatment in care was something that y'all brought up last month, and that's a super important topic, obviously, and I think warrants more of a conversation. So I've asked someone to come who can speak on that very specifically, provide the data and definitions, and so you understand, so she can present what is maltreatment in care, and what the data means in a much better way than I could. So Lisa will come, I believe. When I talked to Ellen, next month's agenda was kind of already set, so she'll come in February to specifically talk about maltreatment in care. The other piece I know that was asked was the relative certification, and if there was some like a one pager, and that's what I sent to Ellen. There's a couple documents. One is a one pager, just overview of the process for our relative certification. Then there's one that is just an overview, which is a bit of a longer document. Whichever one you're interested in, hopefully that will provide the type of information you're looking for. But if not, obviously you can reach out to me. But a couple, again, safety kind of came up in the last month. So I wanted to emphasize with our relative pathway process, which went statewide in August, this past August, that issues about background checks for applicants, for everyone over 18 who lives in the home, the home environment, all are the same. So safety standards, home environment standards are all the same for our relatives as a general applicants. What is different is how we interact with those relatives, keeping in mind research from, I always hear from our manager over recruitment and retention of resource parents. The research nationally shows that folks think about becoming a resource parent for about 3 years before they actually say, okay, I'm going to do this. I'm going to fill out the application and do the process. And then they fill out the application and they talk to folks and they go through, for those who've been around a long time, we used to call it pre-service training. Then we called it foundations. It is now, I think, by far the strongest curriculum we've ever had for resource parent training. We call it RAFT. So they do all that before they're certified. Our relatives come to us, or we come to them, because their family's in crisis. So it is a very different approach. And in all the years I have worked here, and we've never really gotten to a place where we out loud affirmatively acknowledge that difference and work with our relatives in a different way. And we got a bit of a push from our federal partners a few years ago that encouraged states to have different processes for relatives. So that came from ACF. And so we were able to work with, again, some federal partners, but mostly some national partners who for a new home study process. and thinking about training differently. Again, training I know came up right at the end last month. So I wanted to say with our training, we require all of our relative providers to have what we call orientation. So it's an overview. It hits on some aspects of the challenges of working within our system and working with kids who have faced trauma and are in the child welfare system. And then mandatory reporting, which is just a legal basis. All of our resource parents, including relatives, are mandatory child abuse reporters. And then for those caring for infants, we require that they take the safe sleep training, just with all the research around safety of infants and how best to protect them in their sleeping environments. So those are required. All other trainings are available to our relatives. All of the RAFT curriculum is available. What we are asking our certifiers to do a little bit differently is work with our relatives on what makes sense for them and the particular child or children that are placed with them, and to access the trainings that make sense. So it could be various modules of RAFT. We really encourage KEEP, which I'm not sure if anybody from KEEP has ever come to the commission, but it's an amazing resource. And there is an affinity group for relatives. So, they can connect with others that are in similar situations. And any other type of training that, again, works for that particular family structure. So I talked really fast and a lot. Maltreatment and care will come. And hopefully the information provided, I think Ellen just put it in the chat, will give you the information you're looking for regarding what we are doing with the new relative pathway. Casey. Oh, sorry, Dan. I saw Casey's hand, so I said Casey.
Oh yeah, and no worries, Casey. Don't worry. This will just be like a 5-second question. So you said pathway for infants. Something training for infants. What training was that called?
It's called Safe Sleep.
Safe Sleep. Thank you.
Mm-hmm.
Oh, thank you, Donna. I just had a quick question for you that under OAR 411-346-0150, the general requirement for certification, if you've been convicted of a certain crime, you're essentially ineligible to be certified. There doesn't appear to be any waiver or any second consideration process for some of these crimes, even when certain crimes were 31 years old. Mm-hmm. My question is that always in the best interest of the child from the agency's perspective, or should there be a possibility for review, given that just as an example, I've got an 11-year-old that would like to be with a family member. The family member has something in his history that prevents him from getting certified. The next best option for this 11-year-old, if he refuses to be in care, is essentially to run away. And it doesn't seem to be like the best interest of the child, in my opinion. And so is that something the agency has ever considered, of whether there should be a second option or a second consideration for people who, because currently it's in statute, right? There's nothing the agency can do. But has the agency considered that as a possible amendment for the legislature?
It's a great question. The statutory requirement is linked to federal law, which ASPA. And it's ASPA that lists the ineligible felony convictions. So it is very much out of our hands. There was talk briefly when we were looking at relative pathway. The National Consultant Group recommended to states that they have an approval process for what folks might call no-never convictions. And then we couldn't claim $40 because that part of the federal law did not change with the relative pathway. So But our legislative statute, because it links to the federal requirements, we couldn't really do that. When you ask a question about the agency's perspective, like as I think Rachel said, with the largest agency in the state, I'm not going to speak for the agency. We have not successfully been able to move the dial on criminal history background checks in the legislature. As you know, as I've talked about before, in fact, this last session increased the checks that we do. Now we do these checks on 18, or we will in January, on our young adults in care. If that came from another entity, it might get more legs. I would love to talk about that particular case if outside of this meeting, just to make sure. I always want to really make sure that it does hit that must deny. I've staffed a lot of cases where people think it hits there and it actually doesn't. So, we could always chat about that, it has to be a felony conviction and just a few felony convictions. But if it does hit there, there's nothing our program can do. Folks have reached out to others in the department when these situations arise. Yeah, that's what I got. It's a great question.
I noted in the chat, Donna, that I'll email your documents out. Sometimes copying them from doesn't quite work, or sometimes people might have it in case anybody has any trouble opening that. I don't know if anybody's tried, but I'll email them out after the meeting here.
Thanks, Ellen.
Malik, I'll let you keep handling the next section because I'm in my truck and not prepared to.
Yeah, you're good. Well, if there's no other questions, move over to if anybody else, guests or commission members, have anything they want to bring to the group. If not, we can move to public comment.
Malik, I have one thing that I wanted to say just because I had my hand raised during Rachel's section, and then my court case got called. But I had seen, looking at the lawyers portion of it, I had seen OPDC, the Public Defense Commission, had proposed as part of their 5% cut, just basically moving some of the funds from state payments to county payments. I don't know if that's from my perspective, that doesn't seem like a very prudent way of handling the state's crisis, is to just be moving it to the counties, because, whatever 5% of a state agency budget is, it's probably a much bigger impact than 5% on a county's budget, I would imagine. So, that's something that we can continue to watch, because I know it was not actual cuts, but kind of proposals. But that was just something that I saw in one proposal that I was like, well, a 5% cut isn't really like kicking it to the counties, right? That's all I had.
Casey, where did you see those? Because I was trying to look those up and I don't know where the documents for the proposals were from the different entities.
So I didn't have a collection of documents. I found OPD specifically because I've been told by several people that one of OPD's solutions to the 5% crisis and the attorney crisis is to quit representing or quit appointing attorneys to represent children in both juvenile dependency cases and TPRs. And so I was trying to follow up on that information. And when putting that in, I got their November 8th letter to the legislature regarding that.
Okay. Does anybody else have anything else they want to bring to the group? All righty then. Let's move to public comment. I know we have some.
I don't know how to raise my hand, but I would like to just say something really quick if that's okay.
Yeah,
Is this a
absolutely.
good time to do? Okay.
Yeah.
So I've been coming to this commission ever since I started in this position as the foster care ombudsman, and I'm very invested in this commission and everything that this commission is doing. And I just want to I guess, announce that I'm going to be switching over to the children's advocate side of things within the governor's advocacy office. So I'm going to be switching from the foster care ombudsman role to looking at all programs under the umbrella of the Oregon Department of Human Services, including still child welfare, but with a different focus. It's kind of an area that I recognize I need to understand a little bit better. So I'm going to be switching over there. So my current position as the foster care ombudsman will be posted. We anticipate it will be posted this week. So if you know anyone who's interested in serving Oregon in this capacity, I'm happy to answer any questions. I'm not sure, if we'll do an informational session where I will be there, but please feel free to reach out to me if there's anything I can provide for you. Thanks.
I'll reach out, Alexis.
Wonderful. I'm here.
If there's no other public comment, are we ready to adjourn? I wasn't sure if there was anything else on the agenda. I don't have it pulled up.
Oh, Casey, we did skip over you. You were supposed to talk about the bylaws committee. I don't know if you want to move it to next meeting, we
Yeah,
can, but
yeah, let me say two things on that. So first, I'd entertain a motion, or if we don't need a motion, we could just bump it. But I'd certainly be in favor of tabling this through this meeting. Here's my thought on that real quick, is that I think the bylaws committee is very important. I've had a discussion with Rachel about where we are with commissioners and kind of the workload. I don't know about all of you, but between the prep meetings, these meetings, education committees, I'm feeling pretty tapped out. I would absolutely love to do a bylaws committee. I don't know how other people's bandwidth are feeling, but currently we're going into a legislative session. We're looking at 5% cuts across the board. We have a big role in kind of looking at those and giving feedback on those. So, my thought is, if we're going to do a bylaws committee, it might make sense to do it after the legislative session. And once we have an opportunity to maybe get a few more commissioners, so that we're not, each on every single commission or subcommittee. That's my general thought, is to bump it down the road a little bit. If somebody is really interested and wants to take a look at it now and start to make proposals, I think that's fine too. But I'm not in the position where I think we should be firing back up a formal bylaws committee at this point. I don't know how other people feel about that.
I support this and pushing it down the road. I don't know if anybody else disagrees.
No, I support that as well.
And I should say, we're not just like booting this for no reason. Like, we did look at our bylaws and redid them, I think the beginning of 2024 or 2023. So they are within a couple of years. So I don't think we're losing anything. I think we're just, focusing our bandwidth where we can.
Thank you, Casey.
Nobody disagrees, so I think we're all in a shared opinion that we are good to push this down for a later date when we all have sufficient capacity and ability to really focus on it intentionally.
I put it in the chat, but I'll be willing to serve on that one when it's time.
Thank you, Judge.
Thank you.
Thank you.
Okay, so let's go ahead and adjourn the meeting then at 12:59 p.m.
All right, thank you. Have a good day, everybody.